And we're getting people in.
Good morning,
everybody. Welcome. We're going to get started soon.
Give us about 2 minutes and we'll get started. Still have more people joining us right now.
Yeah, we've got 6, 7. It's starting to fill in.
Okay.
You can give it a little bit if you'd like.
Okay.
Yeah. A few more folks coming on. So give it a few minutes. Hey, everybody, welcome. We'll get started here shortly. It's growing as we go.
All right, we ready to go here? Good morning, everybody. I'm Tim Sheehan. I'm the Executive Director of the Alzheimer's Association, and it's my pleasure to introduce a good friend and also a new board member of the Alzheimer's Association, Buffie Saavedra. Buffie is the Community Member Director of Molina Healthcare, New Mexico, and you hopefully are in the right session because it's the best one right now. It's called Navigating Long-Term Care in New Mexico. So with that, take it away, Buffie. I appreciate you joining us today. And one last comment is if anyone has any questions, we will have you put them in the chat room, and then we will answer those at the end of the session. Take it away, Buffie.
Excellent. Thank you. Thank you, Tim. And it's a pleasure. First of all, want to thank you all for taking time out of your busy day to join us. I was part of the exhibit hall this morning, and that was interesting to navigate and a lot of fun. And had the pleasure of listening to our opening and our keynote speaker, our governor. And my dad is actually State Representative Kiki Saavedra. So the Kiki Fund that she referenced, if you joined, that was my father, who is State Representative Saavedra. So we're just honored to have the fund in his name and really excited to see innovations that come out and about to support all of the hard work that needs to be done for all of our New Mexicans that need help and the caregivers that I call heroes. So, and I think everyone does. Well, welcome to the session. I'm Buffie Saavedra. I'm a native New Mexican. I've been here my whole life and love it, obviously. And I am so excited today to visit with you about long-term care options in New Mexico and really just navigating the social services and private system. Have a background of approximately 32 years of experience in and out of healthcare advocacy as well as healthcare management. And I've had the pleasure of working for state government and actually for our governor prior at the Aging and Long-Term Services Department. And so today, have some information for you. I hope you find it useful and really excited to answer questions and try to assist and support. So let me get us going here and always have to see if I can change screens. There we go. So long-term care. So my whole exclamation point is what? What does that mean? What is it? Why should we even think about it? So I have 3 points to make to kick us off. So the need for long-term care can come along in life at any time. So we might think that it's only for the aged, but we never know what's going to happen. And we don't know if and what we might be afflicted with or what those we care for might, or if we'll have an accident or what can happen. So the need for long-term care can come along at any age and any stage. Long-term care isn't just nursing home care, and long-term care isn't paid for by standard healthcare insurance or by Medicare. And I think that is one of the biggest shockers that most people come to discover. So we're going to start with any age, any time. So there are different reasons someone may need long-term care. Some examples are aging, as we age, and I feel it with now that in the mornings that are colder, my arthritis starts to set in. Other things happen to us with age. We've had our lives happen, and we may experience hopefully old age without any afflictions, or we may have a disease that we have, end up experiencing. My dad did die of dementia, of Alzheimer's, and someone that was extremely healthy. I saw, go through all of the stages and phases, and what a debilitating disease. So disease such as Alzheimer's could be another reason that we might be considering long-term care options for ourselves or our loved ones. We could get in an accident. Someone we love could get in an accident and change their life or our life forever. And we could have a loss or lack of our abilities. So we might start experiencing some change in our abilities. We might be born with different abilities. We may have different abilities of performing our daily activities, such as bathing and dressing and eating. And so some of those things are, different for each one of us. And that may determine why, as time goes by, we may need to consider long-term care options. So long-term care settings can differ. Long-term services and supports can be provided, I think as most of us know, in a long-term care setting, like a nursing home, nursing care facility. And long-term services and supports actually, especially in New Mexico, we're one of the leading states in having opportunities for community setting of long-term care services, meaning at home or in an assisted living facility. So how is long-term care paid for if insurance doesn't cover it, or health insurance doesn't cover it, or Medicare doesn't cover it? So there's three really key avenues of payment for long-term care. Someone can purchase a standalone policy called long-term care insurance, and that, dependent on age and health status, can be quite expensive. And not all policies pay for the same thing. Some only cover facility care, some might cover care at home, some may not cover a dementia diagnosis. So that is something we'll talk about in a little bit. Some people pay for it themselves. They may have saved all their lives, like my grandfather. My dad's father was a cobbler. He repaired shoes, made shoes, had Superior shoes in Albuquerque for almost 50 years downtown. And he, sixth grade education, and he did all that, and he had money in savings, and that's what paid for his long-term care toward the end of his life. Some people have been able to save and do that, and they may use all of their resources or most of it to pay for it. Sometimes family helps pay for care. Friends and relatives might pitch in to help pay for care. And then the other opportunity is Medicaid. And state Medicaid is the payer of last resort. And many times, because long-term care, whether it's in a community setting or a facility, can be very expensive. So let's dig in. There are so many considerations that we must be all aware of, and we should be aware of them now. So the things we should think about ourselves, regardless of our age, is our age, our health status, our financial status and abilities and capabilities, our medical history as well as hereditary history, and the future. We should think about what the word future means. The future could be the next minute, the next hour, the next day, month, year, or years later. So the future is just this next period in time, and the need could come sooner than later for us or for those we care for. So we're going to start with long-term care insurance. So there are resources that are available to all of us so we can do our homework first. One of the resources that is a national resource is actually the American Association of Long-Term Care Insurance. So just like the Alzheimer's Association or other associations, we have that opportunity to utilize that resource to go in and glean public information. It's not a sales entity, so it provides us what I would call very fair information. And it provides us the opportunity to dig around and get our questions answered. So use your resources, do your homework. Another great resource, and I know they're one of our key sponsors, and they're also presenting today, Mr. Gary Williams is AARP organization. So nationally, AARP has great online resource information as well as information through their local state offices and teams. And so I provided both of these links in this presentation that you'll be able to utilize to find more information. So information is key. So does long-term care insurance cost the same? So the answer is no. Each insurance company sets the rates differently, and all of the rates are dependent on many factors. And one of the factors is actually age. So I provided you some examples. This is actually information from the National Association, and it just shows you the variation and also how expensive this can be. So if in our 50s we were to purchase a policy, we can see that it can be really expensive. And this is before we even ever use it. And so really good to think about what it means in buying a policy and how one would be able to maintain payment of that policy over time. So you can see there's some really differing examples here. And these were just, some of the examples that are provided on that website. So let's talk about self-pay. So families, individuals, savings, sale of assets, cash in of resources, all of those considerations are likely considerations for many people, if not most, before they tap into state resources. And depending on someone's need and how long their longevity, that their lifespan continues to be, that cost can be quite astronomical. And so when we looked at the prior cost of the long-term care insurance, the coverage itself actually doesn't pay for all of the need that someone might have if indeed they end up maybe in a higher level facility, for example. And so the biggie, and I think this is prevalent here in New Mexico, is Medicaid. And we could all be grateful and should be grateful for how well managed our state manages Medicaid and all of the services that provide what we call long-term services and supports in New Mexico. So New Mexico has one of the most robust long-term service and supports programs in the country. I know we usually are last in most things, but we are actually very high up on the scale in how great we fund and manage our long-term services and supports here in New Mexico through our state Medicaid programs. We have lots of different opportunities, but there are three key pieces of what I would call the Medicaid long-term services and supports puzzle. So how do we get started? So the big thing is making a phone call. So when we talk about resources, we have one of the most stellar, I would say, departments in the state called the Aging and Long-Term Services Department. And they are a key sponsor of this conference as well, and participants. They house what is called our Aging and Disability Resource Center. Those are national centers that each state or maybe even community gets funded for. And here in New Mexico, we have one large overarching umbrella resource center. And the team in the resource center can answer so many questions, but these questions and the assistance and support include helping you, your family, your client, whomever that is, navigate and access our New Mexico Medicaid long-term care programs. I provided the phone number here so that you will have it when this presentation gets uploaded. So what long-term services and supports are available through New Mexico Medicaid? So there is nursing home care, which is usually for the custodial care needs, meaning that in New Mexico, at least, someone needs to have what's called a nursing facility level of care determined, They would not be able to perform 2 or more activities of daily living and independent activities of daily living. And that care is actually 24-hour care. And usually for individuals that can't do most of their independent needs on their own, bathing, dressing, making meals, ambulation, mobility, all of those are considerations. Assisted living, usually for what we call intermediate level of care and support, where individuals that tap into assisted living for long-term care service and supports would still be able to do some of their activities with independence. And so they wouldn't need the majority of support, but they do need some support, some check-in, some assistance. And then finally, there's home and community-based services. And these are called community services. It's a term that include but aren't limited to adult daycare, personal care, environmental modifications, respite, and full Medicaid is included in that for all the physical, behavioral health, dental, vision, transportation, and so much more that individuals need just on that coverage side, in addition to the long-term services and supports. So there's a couple of avenues to start with. If somebody is already on full Medicaid, which in New Mexico is called Centennial care, then they have access to these long-term services and supports. So let's pretend it's me and I'm on Centennial care, but I'm on Centennial care and all of a sudden I start having a change in my health status, or I had an accident, or something else may have happened. Maybe I had a fall and I have not recovered from breaking a hip or otherwise. Then I need what's called an assessment or a reassessment to determine what long-term services and supports are available and what I might need. So if somebody is already in full Medicaid in Centennial care, they would need to contact their managed care organization with Centennial care to then get more information and get what's called a health risk assessment reperformed and a comprehensive needs assessment. Those assessments determine what benefits and services are in need, and they trigger that entity getting the ball rolling so that that member of Centennial care, which could be yourself, your loved one, a client, whomever that is, to start receiving those benefits and services. Now, if someone is not yet in full Medicaid, they're not on the Centennial care program, then there is a greater process. And the process is actually, I feel, very simple in New Mexico, because I mentioned the Aging and Disability Resource Center before, and they are the key. I guess I call it the no wrong door, which is their mantra on their website. They are the key for accessing and getting into the services and benefits, okay? So there is a waiver, it's called the home and community-based waiver. So if someone's not yet on full Medicaid, this would be the waiver that one would apply for if they're looking to remain in the community or to live in an assisted living facility with Medicaid covering the services and providing the funding for the home and community-based long-term services and supports. There is income information in this slide. I want to note that annually that usually changes, and it changes in the first quarter of each year. So right now, the income limit is $2,349 a month with an assets and resource limit of $2,000. So if the client is over this, it says MAD, that's the Medical Assistance Division at our New Mexico Human Services Department. They will visit with the client or the individual that you might be working with, or ourselves if it's us, about an income diversion trust so that person can become eligible. So the phone number again is here. You'll see that more often than not through this slide deck because it is the no wrong door place for us here in New Mexico for long-term services and supports, education and access, okay? The home and community-based waiver allocations are not unlimited. So usually an allocation depends on a person's level of need and the extremity of need. And so it's very important to know that by calling and being in the income qualifying range doesn't mean that a waiver allocation will automatically happen, okay? And in some instances, someone, and hopefully this doesn't happen often, but it does, may end up accessing a nursing facility first, being on institutional Medicaid, which we'll talk about next, and then integrating out back into the community on a waiver. So that's part of some of the process that is available here in New Mexico as well. Not the preferable process, but it is available. So let's talk about nursing home care covered by Medicaid in New Mexico, and it's called institutional Medicaid. So institutional Medicaid financial eligibility is the same. You saw the prior slide for home and community-based. It's the same financial eligibility, and it's actually the same nursing facility level of care of not being able to perform 2 or more activities of daily living, albeit to get a waiver allocation, as I mentioned before, because they're not funded for every applicant. There is a wait list. The higher the need, the higher the risk, the possibility that an emergent allocation will be provided. So with institutional Medicaid, there's not a waiver, a wait list, that type of thing. But there is an equivalent asset and resource amount of $2,000. And then you can see there's information here about married applicants, about how much of a couple's assets and resources can be maintained or protected for the spouse that is not going to be going into institutional Medicaid or coverage. And there's a lot more information that can be accessed. By calling the Aging and Long-Term Services Department, one would be able to get some more assistance and support or be referred to possibly legal services so that people can ask more questions, especially if their income is above the $23.49 per month as an individual, or if there's other questions and concerns, or the need for a trust build for other resources that might be existent that would take away from someone being eligible. Just a point of reference, one home and one vehicle are not considered countable. And so it's the $2,000 separate from that. Okay. I know this is a lot of information. So more information on institutional Medicaid. So once someone is approved, this is an interesting aspect of it. It's called a Medicare credit. And so a Medicare credit or medical credit, pardon me, is paid to the institution to defray some of the costs that the state would be paying otherwise. And so there's a little amount of money that's taken out of that monthly, $74 a month, so that an individual can utilize that for personal expenses. But then everything else from a person's Social Security would be going toward the nursing home to pay for the care. And so there is part of our ownership as individuals for payment of it, even though it's Medicaid covered. Okay. So what's the benefit? Well, in nursing facilities and acute care hospitals, there are lots of different care that's provided, and it is skilled care. And I think that's a big thing to know, is that Medicare covers skilled care, but not custodial care. And so the need of long-term care, 24-hour care, that's not to go from maybe, a state of, I used a broken hip example prior, like a state of having an injury and then getting better. So that's called skilled care. And then physical therapy and occupational therapy, that happens after a stroke as well. Custodial care is if someone is not getting better, it's the after. Someone can still not perform IADLs to where they're going to be safely at home, either alone or with others, and they need further care. Alzheimer's is another really good example. It's not the physical, although it does become such, but even the ability behaviorally to be able to be safely at home, either alone or even with others. And so many times custodial care is needed. There's a different process to apply for institutional Medicaid, and it is actually directly through the Human Services Department, not through the Aging Department in New Mexico. There is a link that you'll find in the presentation when it's uploaded to be able to go in and navigate and learn more. Many of you may already know about all of this, but this is just really important to know. And again, for ourselves, I think one of the great things about being in healthcare and advocacy and all of this work, all of these years, is learning all of this, and to be ready. And even then, I don't think we're ever really ready. But this is, I hope, good information for you to digest. So there's another opportunity that's available, and this is called the Program of All-Inclusive Care for the Elderly, and its short term is PACE. It's a good acronym. It's not provided everywhere, and so one would have to live in the service area of the PACE organization, and currently I believe it's Bernalillo County that here in New Mexico it's available in. It may be available in other counties and communities within, but there is a link on the next slide where you can go and look up that information. When I was navigating it earlier, it didn't give exact locations, but it did just show the Albuquerque location. So that's why I'm mentioning that may be the sole service area at this point. The eligibility is a little different. One would need to be age 55 or older. They would need to be eligible for nursing home care. So that could be whether it's the community eligibility or the facility that we mentioned before. That means not being able to perform 2 or more activities of daily living or independent activities of daily living. They need to be able to live safely in the community. So that's different than custodial care, the nursing home, full nursing home stay would be that someone would be able, they would need to be able to live in the community. So performing some sort of things independently and not necessarily needing full-blown custodial care. The interesting thing about PACE is that PACE becomes somebody's everything. It becomes their Medicare and their Medicaid. And so it is all-inclusive care. And then it provides their long-term services and supports. So it is everything. So the benefit and services are noted here. You can see the Medicare and Medicaid pieces here. For most people, this lets a person have everything in one place and space, but again, it's not provided statewide. There is a contact number here, and the entity that manages our PACE program in New Mexico is called InnovAge of Greater New Mexico. InnovAge provides this service in other states as well. So if you navigate into the website, you will need to go to New Mexico. So I'm sorry, my son just popped in, it scared me. So that's the information for long-term services and supports. There are 3 key considerations. The first one is need. So what does somebody need? If it's you, or if it's your family member, or if it's a client or a friend, the need is the first thing to think about. I know when my dad started showing signs of just being, I would say, different, we were starting to think about what he needed. How could we help him navigate life in the different phases that he began to experience? So the need will change dependent on what that person is experiencing. Somebody might just need a walker. Somebody may need much greater care. Somebody might be able to still drive, but they may have other things that they can't do. And so the need identification is key. And if you're a family member of someone that you're just attending this conference maybe for the first time and you're just learning, just be ready to know, especially if they have a dementia diagnosis, that need is going to ever change. And as we age, our needs are going to change. And so just really important to know that it's fluid. Otherwise, it'll be challenging and the disappointment can be extreme. And even as much as I know and have experienced through just my work with all of this type of health coverage and long-term care coverage and support information, I was still taken aback by how different my dad's needs were as his disease progressed. So the need is key. Financial, what is that individual's financial status or our own? What are we going to be able to do, afford, not afford? It's okay. It's just, that's kind of a big thing to know and consider. And I think it's important because that will then also lead to our knowing what our environmental needs are, meaning I currently live alone. So if I was the person in need of services and I'm considering all of this, I would have to be able to be home alone most of the time and be able to take care of myself because I don't have somebody else to do that for me. Other people might. They might live in a household with a lot of family that might be able to provide some supports and care. We call that natural support. So there's paid and unpaid caregiving and so on. Or someone might actually live in a home with people, but there's stairs and their living quarters or bedroom is upstairs. That environmental change may need to happen so they're safe, and they're downstairs, like all of those things. And so, and it's cyclical. So it's the need, financial considerations, and the environmental determinants. Someone could be safe in a home setting initially, and then their need could change to such that that home setting isn't safe for them anymore. And it might not even be the physical parts of it, but it might even be that there's needing to be more people caring for them. And I'll just, again, glean on if they have a dementia, Alzheimer's diagnosis in particular, we experienced it. The challenges of keeping everyone safe, including our father, changed dramatically as his disease continued to progress. So that environmental aspect, we had to consider what that meant for everyone, including those who were caring for him. Okay. And so now I'm hoping that this is going to be conversational, that we have some questions possibly in the chat or that might get loaded into the chat, and we can visit. So that was a lot of information. I can go back to certain pieces if you'd like. I can also try to answer your questions, take information back. And I also have a resource directory open if I need to try to refer anybody to another resource. So I hope you found this useful and interesting. And I'm gonna stop sharing my screen and then see, well, maybe I'll keep it up. Tim, I was gonna see if we had anything going on in the chat.
Actually, we just had one person asking if the slides might be available.
Oh, good. Yes, the slides I'm thinking are going to be available. Is that correct?
Yes, well, we will actually have this all recorded, and in our follow-up email to all of our participants, we will have that all the links to all the different presentations we've had throughout the 2 days.
Okay.
And also what I could go ahead and do, hello, it's Denise here. What I could go ahead and do is upload them quickly to the files tab. So if you're looking at the chat, to a few tabs over, there's a files tab. If you click on that, right now there's nothing in there, but I'm going to go ahead and load Ms. Saavedra's slides, and you'll be able to go ahead and download those onto your computer. So just stand by. If you guys have any other questions, go ahead and post them in that chat area as well.
Excellent. And something I'll say while we're, giving folks time to think about maybe some questions that they have is that when we talked about if somebody is on full Medicaid already, I think people might think, well, how would I be on it already? So let's talk a little bit about that. So individuals that are on supplemental security income in New Mexico, and again, that's through Social Security Administration's determination, so not through our state Medicaid determination, they get full Medicaid in New Mexico. So, and these individuals have a much lower income level than what is required of the waiver or institutional Medicaid amount. And I had some information up on my screen. I have to apologize for my eyes roaming around. I have 3 screens and only one of them has a camera. But an individual's income, and this is such a drastic difference, to be on SSI is $783 a month or less. So if we can kind of digest what that means, individuals in New Mexico, not in every state, that are on SSI, supplemental security income through the Social Security Administration, their income would be $783 or less. And these individuals have full Medicaid in New Mexico. So what that means is those individuals already have access to long-term services and supports as they need them. And as I mentioned before, those individuals would be in full Medicaid. It's called Centennial Care, and there are great managed care entities that manage that care for the state of New Mexico right now. And they would be reaching out to their organization to ask for further help. Some folks are in Centennial Care and may not have had contact with their care coordination team, which is not abnormal. It's a normal thing because they may not have needed anything. But as I mentioned in my opening, things can change, in a heartbeat. And so just knowing that if you're already in full Medicaid, or if the person you're helping is, and they're in full Medicaid called Centennial Care, they have access to long-term services and supports, and they have auto access to institutional care. So all of this is at their fingertips, or at your fingertips, if it's you or your family member. Okay. So I just wanted to point that out. I'll check back in with Denise and Tim. Any other questions or conversations?
I haven't seen any other questions right now, but I would also remind everybody that both you and your team are available in the exhibit hall.
Yes.
So please stop down and chat with them in the exhibit hall either today or tomorrow.
Yes, please do. I have my email up there, and just knowing, you're also welcome if you're a service provider, legal services, you're welcome to use this presentation because it does have good, I think, phone numbers and links in it. You can remove my name. It's not Molina based presentation, but I have a love and passion for long-term services and supports programs. I was blessed to have work at Aging Long-Term Services way back in the early 2000s when our governor was our agency director before we were a department, and ran a couple programs there, loved it. Had the opportunity to help again last year or earlier this year. This year feels like a decade. It's just something that I've learned and enjoyed learning more about. So always know that you can reach out to me and I can try to get you to the right person. When my dad was still alive and he was a legislator, he would always call me and say, I have a senior that called me, from the district, can you call them back? And he didn't know really what all I did, but he knew I knew how to get people to the right place. So just know that I'm happy to help, but that Aging and Disability Resource Center is probably one of the best in the country. And the team there, under the leadership of Secretary Katrina Hotra Lopez, is just dynamic. So I would really, encourage people to give that number out, make a phone call, be patient because of during COVID, a lot of times folks aren't able to answer live, but they will get back to you. They've got a great chat feature on their website, and there's just a lot of opportunity for questions and answers there.
Buffy,
All
we do
right.
have a question here.
Okay.
How does it transfer from Medicaid for my daughter who has Down syndrome, I'm guessing? My question is, how does it transfer from Medicaid for my daughter who has Downs?
Okay. So depending on what your daughter has, as far as her Medicaid, she might be in the Med-Frag program. She might be in the Developmental Disabilities program, or she may be in regular waiver, home and community based. So depending on where she falls, you would make different contacts. So if somebody is in the medically fragile program or in the developmentally disabled waiver program, the Department of Health manages the long-term services and supports side. Okay. If somebody is in the home and community-based waiver or in any other category of Centennial Care, either through SSI that we mentioned before, or maybe it's in a non-LTSS category, they would go to their MCO with Centennial Care. And that's either Blue Cross, Western Sky Centene, or Presbyterian. So that might sound familiar to people. Someone's in the developmentally disabled program, they have their physical and behavioral health managed by one of those managed care organizations, but their waiver services, their long-term services and supports would be over at the Department of Health side. And the Centennial Care Managed Care Organization should be helping you coordinate care through the Department of Health's programs.
Okay, thank you, Buffy. I don't have anything else in the chat right now. I want to thank you again for your total commitment to our organization. Yes. And for your great knowledge and wisdom today. We really appreciate it.
Thank you. Thanks, everybody. Short and sweet, but I just hope that you found it useful, and hope I didn't blow heads off of bodies.
And please stop down in the exhibit hall and visit one-on-one with her team. Thank you very much.
Thanks, everyone.
Appreciate it.
Thank you. Have a great day and a great weekend, and stay safe. Wear your masks. Wash your hands. Bye.
Bye. All right. I think we're done.
Nice. Do I disconnect now?
Yep, you can just disconnect. We're all set.
Okay.
Thank you very much. I got my
Good.
computer fixed while you were talking away, so that was good.
Good. I hope it went well. Thank
All
you.
right. Oh, it was
Okay.
great. Thank you. Bye. We'll see you tomorrow. Bye.
Tomorrow.